Hello! In this Syneron training video, we are going to demonstrate the proper use of the VelaShape system for body reshaping and the treatment of cellulite. You will learn how to operate the system and conduct your patient's treatment procedure. At Syneron, we specialize in safe and effective medical systems using our unique Vela and ELOS technologies. Our line of products covers a wide range of clinical applications, including circumferential reduction, cellulite treatment, skin rejuvenation, skin tightening, hair removal, treatment of leg veins, and treatment of acne. Over 10,000 patients a day around the world are being treated with the Vela family of products. The VelaShape is the first FDA-cleared system for circumferential reduction and cellulite improvement. It is also effective for these treatments post-liposuction or following childbirth. The VelaShape offers additional benefits, such as temporary improvement in local blood circulation and relief of minor muscle aches and spasms. The VelaShape achieves all this by using a unique combination of 4 technologies: radiofrequency, infrared light, vacuum, and mechanical massage. Let's take a closer look at how it works. The VelaShape applicator is gently applied to the treatment area. Pressing the trigger activates a vacuum coupling and massaging effect. At the same time, infrared light and radiofrequency energies are emitted. The pulsed suctioning, combined with movement of the rollers over the area, draws the tissue closer to the heating source, demarcating the target. It also causes widening of the local blood vessels, as well as increased blood circulation and lymphatic drainage. The infrared light and radiofrequency energies deliver heat to the dermis and hypodermis, causing the release of oxygen and nutrients from the bloodstream to the local cells. In the hypodermis, the combination of heat and additional oxygen leads to increased metabolism in the fat cells, causing them to shrink as they break down their fat. Mechanical massage enhances the flow of these fat breakdown products, along with trapped fluids, to the lymph system. In the dermis, the collagen fibers, including those of the septae, shrink, resulting in smaller fat chambers and skin tightening. The heat causes collagen shrinkage and activation of the fibroblasts to synthesize new collagen fibers. The end result of all these changes is localized circumferential reduction, improvement in cellulite appearance, and ultimately, body reshaping. Let's review the patient treatment procedure and operation of the VelaShape system step by step. The VelaShape system has 2 applicators. The V-Smooth is used for cellulite treatment and circumference reduction in large areas such as the thighs, buttocks, or abdomen. The V-Contour is used for contouring small areas such as the lower abdomen, flanks, and upper arms, or for curved areas, or for localized fatty deposits. It is also used for reinforcement after treatment with the V-Smooth. Both applicators are connected to the system at all times, and both will be used in this video. Regardless of which applicator you use, the goal of each treatment session is to raise your patient's skin temperature to an end point at which substantial and persistent radiant heat can be felt about 5 millimeters above the skin. It is usually accompanied by erythema. The patient should feel a deep heat sensation with minimal discomfort. This typically occurs at a temperature of 40 to 42 degrees Celsius, or 104 to 107.6 Fahrenheit, and can be confirmed with a laser thermometer. Once this endpoint is reached, the heat must be retained for at least 10 to 15 minutes for treatment to be effective. Before your patient arrives, the treatment room should be set up with ample Vela Spray Ease lotion, tissues, towels, measuring tape, and a white eye pencil. The first step in the treatment procedure is preparing your patient. Discuss the treatment goals at the outset and establish realistic expectations depending on your patient's treatment area, age, health, and lifestyle. Explain to your patient that 4 to 6 weekly treatment sessions are recommended for most patients, followed by additional maintenance sessions every 1 to 3 months. In most cases, one can expect to see tangible results already after the first 2 sessions. A healthy lifestyle with no weight gain ensures long-term results. Be sure that you and your patient remove metal objects such as jewelry, watches, and eyeglasses. Confirm that your patient has no medical contraindications to the VelaShape treatment. For a complete list of contraindications, refer to the VelaShape user manual. Before the first treatment session, it's important to weigh your patient and photograph and measure the circumference of the treatment area in order to establish a baseline. Re-photograph and re-measure at the completion of treatment in order to document the results achieved. Reweigh your patient before each session to check for weight gain. We will start with circumference reduction and cellulite treatment using the V-Smooth applicator. Have your patient stand and mark the treatment area with a white eye pencil. For cellulite treatment, pinch the skin in order to locate the exact areas with cellulite. Explain to your patient that during the course of the session, they should expect to feel a comfortable but gradually increasing heat sensation in the treatment area. It is often described as a warm massage. If the patient begins to feel discomfort, they should let you know immediately so that you can adjust the system settings accordingly. At this point, your patient should recline comfortably. Upon startup, the system will perform a 10-second self-test to verify proper operation. During this test, 3 vacuum pulses will be audible, and the system will be temporarily disabled. It is important to pay attention to the vacuum level indicator on both applicators. If it is continuously flashing from level 0 to level 3, this indicates a clogged filter. If it is continuously flashing from level 3 to level 0, this indicates that either there is no filter in the applicator or filters are not placed properly in the V-Smooth applicator. Hold the V-Smooth applicator and adjust the settings as follows. For the first session, set the IR to level 2, RF to level 3, and vacuum to level 1. For subsequent sessions, increase the IR and the vacuum levels gradually, as tolerated by the patient. Apply the VelaSpray Ease lotion to the treatment area for coupling and lubrication. It is essential that the entire skin surface be covered. VelaSpray Ease should be reapplied if movement of the applicator is impaired. Remove any lotion from your hand with a paper towel and hold the applicator to begin treatment. Place the applicator on the skin surface, either vertically or horizontally, depending on the shape of the treatment area. Applying minimal pressure, press the trigger and move the applicator forwards and backwards in strips that are at most 30 centimeters or 12 inches long. Keep moving the applicator back and forth until you reach the end point, reapplying VelaSpray Ease lotion as needed. If there is excessive erythema, move to the next strip and then resume treatment as tolerated. If your patient experiences discomfort, lower the treatment settings as indicated in the user manual. It takes about 3 to 5 minutes to reach the endpoint. When you do, stop treating and move to the adjacent strip of the treatment area. Treat the next strip in the same manner, and then pass over both strips, moving the applicator in slow zigzag or circular motions for about 3 minutes of reinforcement in order to sustain the endpoint. In the event that the treatment area is particularly large, continue treating the next strip in the same manner, and then pass over all 3 strips in zigzag or circular motions for reinforcement. Continuous flashing of the IR and RF LEDs indicates lack of vacuum. This may be due to inadequate contact between the applicator and the skin surface, improper closure of the replaceable cover, or insufficient VelaSpray Ease lotion. For treatment of the inner thigh or hip, your patient may need to lie in this alternate position. You may also need to reduce the vacuum settings for the inner thigh. The abdomen and buttocks are treated in the same way as the thighs, using the V-Smooth applicator. We will now treat the flanks using the V-Contour applicator. At this point, your patient should lie comfortably on their stomach and mark the treatment zones with a white eye pencil. The zones should be approximately 10 by 15 centimeters or 4 by 6 inches in size. Hold the applicator and adjust the settings as follows. Set the vacuum to level 1 to 2 as tolerated by your patient. In subsequent sessions, you may increase to level 3. Set IR to 1 and RF to 3. Apply VelaSpray Ease to the entire area. Wipe off your hands and begin treatment. Place the V-Contour applicator on the skin surface and press the trigger. Applying minimal pressure, hold it in place for at most 7 suction pulses or as tolerated. This is called a stacked pulse. Pick up the applicator and stack the adjacent spot, overlapping by 50%. Keep stacking the adjacent spots until you have treated the entire treatment zone. Repeat stacking over the area for about 4 to 6 passes until you reach the endpoint. This should take about 5 minutes. There may or may not be erythema. If your patient experiences discomfort, lower the treatment settings as indicated in the user manual. Reduce the treatment area size if the endpoint is not reached in approximately 5 minutes, or increase it if the endpoint is reached sooner. Treat the second zone in the same manner, and then repeat the entire process on both zones. If you are not treating a second zone, pause for 5 minutes and then retreat the original zone. The navel area and upper arms are treated in the same way as the flanks, using the V-Contour applicator. Have your patient schedule their next session. We recommend 4 to 6 weekly treatment sessions for most patients, followed by ongoing maintenance sessions every 1 to 3 months. Emphasize that maintenance is recommended. Your patient's response to treatment and the number of sessions they need will vary depending on their clinical condition at the start of treatment and on other factors such as hormonal status.